closing out our conversation, Dr. Greenberg, you really touched on disparities in research. And Doc Griggs, you've been touching on disparities in outcomes and experience and in healthcare and and making healthcare equitable. Somebody once said to me, is the making medicine live up to its own dream. And that's something that I think about over and over when I go through my journey of participating to make healthcare equitable. How can we, Dr. Greenberg, encourage making research and access to these life-changing medications equitable? And Doc Griggs, if you want to close out on how we can make and think about making the experience of dementia care equitable. That's a tall order, gentlemen, I know, but I'll start with you, Dr. Greenberg.
We are developing, as part of we have an Alzheimer's disease research center at Hopkins, and I work very closely with, I'm part of that center, and I work very closely with our outreach core. We're developing uh, relationships with the local community. And if you know Baltimore, you know that is a significant percentage of African Americans. It's Hispanics in Florida and Texas. You know, it's Asians in California. But we're working very closely with the African American community, and I actually have a meeting with uh, people who are going to help us develop community events for outreach into the African American community coming up in the next few months. These are the sorts of relationships that we need. We have a community advisory board that includes members of the clergy for outreach into their churches, into their communities. It's a process of developing the community relations that is required in order to make that happen. Now, unfortunately, we can't go back and enroll these individuals in the clinical trial. So what does that mean? It means if they're going to be taking these drugs, it's basically a phase 4 study. These are people who are taking the drugs in primary care, and their data go into registries, and that becomes a part of the very important building of knowledge of how these drugs are working on much more heterogeneous populations. I'll use that term instead of diverse. Um, but when you stop and think about that, that's a good thing. But these are expensive drugs. And if you're on Medicare, which most people who are taking these drugs are, you're talking about a 20% out-of-pocket copay, which creates a real problem of access. So if you're in a clinical trial, the sponsor of the trial is paying all your costs. But if you're in primary care, you're paying the copays, and that's going into helping to develop the drug for broader distribution. And that's a problem with our system that I don't think is fixable, at this point.
Dr. Greenberg, you nailed it. You always wonder what happens, and I've run into it before. Well, doc, what happens? This medication works, and the trial's over. Like, so what happens? I couldn't afford healthcare to begin with. You have me on this drug. I said yes, and now it goes away. Well, what happens to your community trust then when you go back and you say, well, it just ended, right? So it's a level up, right? When I work with students, they ask what is community medicine. I say community medicine is 3 P's. It's people, it's policy, and it's practice. And part of the problem that by the time it gets down to the practice and the practical level, pardon my alliteration with all the P's, is the fact that the wrong people, a lot of times the wrong people aren't in the room. We have the titles to be in the rooms, and sometimes as physicians, we have to fight to be in those rooms because there are a lot of times healthcare decisions with no healthcare expert in the room. What we have to do is we have to reach back, and with your community advisory board, like he alluded to. We have to bring them and give them a voice in the room to talk about what's practical and what's not. We see it happening with AI. I work with working with an AI Center for Excellence now, and there's some amazing scientific, because I'm such a nerd, things that are great and wonderful, but I'm like, that's great, but nobody's going to use that. Why not? Because they don't even, it's not important. It's not even important. That's not even a biomarker that would attach to anything that we would measure or connect to anything. I'm glad you can see it, but it's great. So we have to reach back, include the community in it starts with conversations and it ends with conversations, because after the conversation comes the support, not only for the family members, the support to get people in the trials, talking to the people that are putting the trials together and making them practical, and then really coming up with a follow-up solution to continue that community trust. But I have to go back to, more importantly, it's like a pebble in a pool, right? A pebble in a pond. Once we start having these conversations and we talk about how these things like Alzheimer's can be multifactorial, and if we slow it down, we can address some of these other things and let them know how they're related. You know, a lot of times people forget that the leg bone's connected to the knee bone, connected to the thigh bone, and the brain is connected to the circulatory system that has our glucose running through it. And what you eat might, if you get diabetic, it can affect the amount of blood going to the brain. And you know, if we have these conversations and take the time to slow down, like you said, to slow it down and give it to people in ways that they can digest it and give it back, I think we can make a lot of progress. But it has to happen in participation, not just at the community level for recruiting for trials, for the community advisory board. We have to pull these same champions. I'm sure in both of your respective spaces, you have community health workers. We have to figure out how we can pull them into the policy rooms and these non-traditional rooms. Non-traditional problems require non-traditional solutions. Does that make sense?
Yes, it does.
To get back to the village,
Spot
that
on.
is child-centered, adult government, elder rule.
I love it. I love it. Well, gentlemen, thank you so much for spending your evening with me. This has been a great conversation, and I look forward to chatting with you again.